let's talk about pneumoconiosis. Pneumoconiosis are basically occupational diseases, chronic occupational diseases that occur in people with certain occupations. These occupations basically expose them to foreign substances that get into the lungs and result in pulmonary dysfunction. The most common of any of these diseases by far is going to be silicosis, meaning that silicosis is going to be one of the most important of them all on your exam. By the way, for your exam, there are two of them that you should master effectively, and that will be silicosis and asbestosis. So pay attention closely. With silicosis, what happens is these people working at, say, someone working in sandblasting, for example, someone working in the quarries, someone working with ceramics, and so on and so forth. Someone that works cutting stone, people that work in foundries, people that hold all of these occupations will be exposed to silica dust or silica particles. Now, when you're exposed to silica dust, it goes into the lungs. What happens within the lungs? Alveolar macrophages ingest these silica particles. When alveolar macrophages ingest these particles, you activate the alveolar macrophages, and these macrophages begin to release cytokines like interleukin 1, tumor necrosis factor, fibronectin, other fibrogenic factors, and so on and so forth. So the macrophages release all of these inflammatory molecules, and these are the molecules that are going to set in motion the process that will eventually result in pulmonary fibrosis and destruction of the lung tissue that is seen in people with silicosis, or really in any of these pneumoconiosis. This process is pretty much the same. So you activate alveolar macrophages release cytokines, and the inflammatory process basically begins. You want to remember that. Now, the other thing you want to remember about people with silicosis is that the macrophages are unable to destroy silica. They're unable to digest silica or consume it, whatever the case is. As a matter of fact, when you have a macrophage that has ingested all of these silica particles, when your macrophages have ingested all these silica particles and they can't break them down, it doesn't just stop there. The silica itself destroys the macrophages. You want to remember that silica weakens cell-mediated immunity. Silica weakens or depresses cell-mediated immunity. By depressing cell-mediated immunity, it decreases the ability of macrophages to kill or contain mycobacteria. So someone inhales or is exposed to silica, the silica goes into the lungs, destroys the alveolar macrophages, weakens cell-mediated immunity, weakens the ability of these macrophages to fight against diseases like TB. And as a result, people with silicosis have an increased susceptibility to developing tuberculosis, Mycobacterium tuberculosis infection. In a normal person, when you're exposed to TB, your macrophages, alveolar macrophages, are able to fight the infection, maybe form a granuloma, a Gons focus, whatever the case is. In people exposed to silica, their macrophages are weaker. These macrophages cannot effectively fight against TB, and these patients as a result, or these persons as a result, have increased susceptibility to Mycobacterium tuberculosis. So you want to look out for that on your exams. The other thing you want to know is that silicosis primarily affects the upper lobes of the lungs. Silicosis primarily, predominantly affects the upper lobe of the lungs. You want to remember that. Now, one of the things they would give you on your exam is what a histologic appearance is going to look like. On histology, what do you see? You're going to see walled appearance of collagen fibers, walled appearance of collagen fibers. When you think of something that is walled, like that, with concentric arrangement. That's what it means as well, right? Very important. Walled arrangement of collagen fibers with concentric arrangement. And we would have calcium deposition on these fibers. So walled collagen fibers with calcium deposition. It's what we describe as eggshell calcification. Eggshell calcification. You see this eggshell calcification in the lymph nodes, for example. You can see them on chest x-ray. So when you think silicosis, again, think of people working in sandblasting, quarrying, ceramics, people that cut stone, for example. Think that silica dust weakens macrophages. Therefore, people with silicosis are at increased risk of developing what disease? Mycobacterium tuberculosis infection and tuberculosis disease, of course. And then also remember that on histology or on X-ray, did I say histology? On histology, you see walled appearance of collagen. On X-ray, you're going to see eggshell calcification. The manifestation is eggshell calcification on chest X-ray, and that is silicosis. Next, we are going to look at asbestosis. Asbestosis. When people are exposed to asbestos, people that work in shipbuilding, for example, people that work in shipbuilding, people that do plumbing of some sort, people that install or remove insulation, and a number of other occupations, mining and a lot of other things, they get exposed to asbestos. Now, exposure to asbestos results in multiple diseases. There are a number of them that are specific for your exam, but there are a lot of possibilities that can happen in people exposed to asbestosis. People get parenchymal interstitial fibrosis, which is what we call asbestosis itself. It's basically fibrosis of the lungs because of exposure to asbestos. People develop localized fibrous plaques. You just have these asbestos plaques localized to different portions of the lungs. They don't have too many symptoms. People can develop pleural effusions, bronchogenic carcinoma, mesotheliomas. Now, it's important to remember that people can get both pleural and peritoneal mesotheliomas. On your exam, by far, pleural mesotheliomas, that's mesothelioma on the lungs, in the pleura, are more common. But remember that there could be peritoneal mesotheliomas as well. And remember that asbestosis might also contribute to laryngeal carcinomas. So, what is the biggest one for your exam? Bronchogenic carcinoma and pleural. I would really want you to remember peritoneal mesotheliomas, bronchogenic carcinomas, and pleural or peritoneal mesotheliomas. You want to remember that those are the biggest, and of course, there is the very basic asbestosis. It's important to remember that bronchogenic carcinoma is by far more common than mesotheliomas. So if a person is exposed to asbestosis, they are way more likely to develop bronchogenic carcinoma than they are to develop mesotheliomas. Okay, it's a common trick question. So when you think asbestosis, you think bronchogenic carcinoma and then mesothelioma. Bronchogenic carcinoma, of course, has even higher likelihood of being developed in people if they also smoke and are exposed to asbestos compared to mesothelioma. Smoking does not quite increase risk for mesothelioma, but smoking increases risk for bronchogenic carcinoma. You want to remember that. The most common finding in persons that are exposed to asbestosis are the plaques. The most common finding you're going to see in persons with asbestosis are the plaques, whether pleural plaques in the parietal pleura. You're going to find these plaques commonly in the parietal pleura and over the dome of the diaphragm. Remember that you're going to have these plaques in the parietal pleura especially and over the dome of the diaphragm. It's important to remember when we talked about silicosis, we said silicosis affects the upper lobes. With asbestosis, asbestosis begins from the lower lobes and subpleurally. Asbestosis affects or starts in the lower lobes and the subpleural region. It can spread eventually as the disease progresses to the middle lobes, upper lobes, but it predominantly would begin with the lower lobes and the subpleural region. So you want to also remember that. What do you see in people with asbestosis? These asbestos particles go into the lungs. So imagine you're going to find the asbestos particle or rods coated with iron or iron containing proteinaceous material. Asbestos rods coated with iron containing proteinaceous material. These iron containing proteinaceous material give these rods a golden brown color. These iron coating on the asbestos rods give them a golden brown color. So when you look at a visualization, when they do say Prussian blue stain, for example, and they visualize the asbestos particle, or they show you a histology of someone with asbestosis, one of the common descriptions they're going to give you will be golden brown fusiform, and sometimes they may say beaded. Fusiform means beaded, the same thing. Golden brown fusiform rods in the alveolar sputum. Golden brown fusiform rods in the sputum of patients with asbestosis. These are simply asbestos rods coated with iron containing proteinaceous material or particles. You want to remember that. Now, when people are exposed to asbestos, just like we saw in silicosis, your macrophages begin to release inflammatory molecules, right? Inflammatory particles. And like we said, these inflammatory agents are going to lead to destruction of the lungs. They eventually result in pulmonary fibrosis. When you have pulmonary fibrosis, there is contracture of the lung tissue. Think of it like the lungs is the lungs, and then we have all this fibrosis going on in the lungs. When fibrosis occur, there's shrinking of the structure or of that organ. Whichever part of the lung is affected by this fibrosis will begin to shrink. As it begins to shrink, it produces an appearance in the lungs that we describe as honeycombing. So, in people with asbestosis, and really in most cases, whenever you have pulmonary fibrosis, you're going to have honeycombing or honeycomb lesions of the lungs. Okay, honeycombing of the lung as contracture occurs secondary to fibrosis. You have honeycombing of the lungs as contracture occurs secondary to fibrosis. You want to remember that with asbestosis. Again, with asbestosis, you have risk for two major things for your exam: bronchogenic carcinoma and mesothelioma on asbestos exposure. Bronchogenic carcinoma is by far more likely to occur, more prevalent than mesothelioma. Asbestos exposure will more commonly result in bronchogenic carcinoma than it will mesothelioma. It's a common trick question, so you want to pay attention to it as well. Finally, the last one is cold walker pneumoconiosis. Cold walker pneumoconiosis. Again, cold walker pneumoconiosis, like the name implies, is going to be seen in people that walk with cold. This is not high yield on your exam. most of the time, these people are just going to have anthracosis. People that work in coal mines and exposed to coal dust, they will just have anthracosis. This condition is probably more common in England and the UK than it is in the United States. As a result, it's not important for the USMLE as much as we would like, even if it's in your first aid, right? So co-worker pneumoconiosis is basically exposure to coal resulting in some form of restrictive lung disease. This condition is largely asymptomatic. It usually becomes symptomatic when these patients have when the disease have progressed to what we call PMF, pulmonary massive fibrosis. Pulmonary massive fibrosis. So when if people just have coal dust in their lungs, you just have a lot of macrophages that contain a lot of coal nodules in them, but nothing special. The patient may be asymptomatic for the most part. You're going to, again, dust-laden macrophages, black lung, anthracosis, mostly asymptomatic. It only becomes symptomatic usually when they develop pulmonary massive fibrosis. You want to remember that.